Ebola among healthcare professionals in West Africa, 2014 to 2015. My name is Anel Ramirez, and other members of my group include Ashley Gahan, Antonia Archuleta, and Chelsea Grosjean. Introduction. Ebola, also known as EVD, is a virus that is rare, deadly, and contagious. It was discovered in 1976. It usually starts with a fever, which eventually can lead to internal bleeding. The most recent outbreak that has occurred since its discovery was the 2014 to 2015 outbreak in West Africa, which became the most widespread in history. Ebola is a very contagious disease that can be passed on from person to person through bodily fluids or by insect bites. With this being a huge problem, it can affect those who are healthcare professionals/workers. The problem. Our population of interest is healthcare workers in West Africa. The problem is that during EVD outbreaks, healthcare workers are at significant risk of EVD infection because of exposure in the community and during patient care. Our goal is to decrease the number of Ebola cases concerning healthcare workers and the rest of the population. Our objectives are to provide equal treatment for healthcare professionals and patients, help gather enough resources and funds, and help improve current prevention methods and develop new strategies to prevent another big Ebola outbreak. Morbidity and mortality, Ebola cases and deaths in West Africa. Since July 1st, 2015, there has been 874 cases of EVD and 509 deaths within healthcare workers. That number continued to increase as more cities began to become infected, as reported by the World Health Organization, as well as available services began to decrease and the fear and stigma continued to increase. As seen in the first diagram to the left, Ebola virus disease, the increase of death of healthcare workers and the increase of closing facilities led to the decrease of healthcare provision, as well as the decrease of availability of services, and the increase of fear and stigma led to the decrease of healthcare uptake. It also which in all led to the decrease of surgery, outpatient consultation, hospital admission, HIV treatment, malaria treatment, ITN, IPT, facility delivery, ANC, PNC, vaccination, and cesarean section. In the graph to the right, it shows the number of cases by city in West Africa. Coverage and consequences. Kenma Government Hospital was the only facility in the country that provided on-site care for patients with Ebola, with the support from the World Health Organization. As the number of patients with EVD increased, a second Ebola treatment unit that was managed by a non-government organization was created and placed in a city in West Africa in July of 2014. Unfortunately, this did not help cease the virus, but instead the ETU became overrun with more confirmed cases. Consequences continued. This created a dangerously low ratio between healthcare workers and patients, which also led to the depletion of personal equipment, low amounts of water, electricity problems, and healthcare workers managing up to 100 patients at a time. Many healthcare professionals even went on strike to demand proper coverage and supplies, which made it harder to treat patients because of the low amount of healthcare workers on site. Because of this, an unusual high amount of Ebola virus infections and deaths were reported among healthcare professionals at the Kenma Government Hospital and Kenma District.